solutions to the most pressing problems in healthcare, utilizing different stakeholders or involving, let's say, different stakeholders from investors, government representatives, startups, and corporates, and not necessarily in healthcare only, but be able to open it up in different industries that can help serve the purpose. So before we begin, I'd like to have a quick introduction so that everyone gets introduced. I know that some people are new, some people know each other, but ladies first. So let's start.
Centric, as the only lady at the table. My name is Sara Musa. I'm head of corporate communications at Roche.
I'm McLean, the founder of Smart Medical Services.
Mohammed Zain, communication information secretary at UNESCO.
Omar Al-Kharani, impact investment at UNDP.
Mohammed Heikel, personalized healthcare chapter head Roche.
Hadi Msad, founder and CEO of Draft Applications.
Tamer Azir, I'm a partner at Two Companies.
Sadiq Hilal, CEO of Q.
Ahmed Gandhi, co-founder CEO of Q.
Aziz Jamal, co-founder of Centric.
Hani Alaa, director of online pharmacy Physica.com.
Ali Shalabi, Chief Digital Health Officer at AXA Health.
Hossein Matar, Chief Medical Officer at AXA Health.
Ahmed Ali, Digital Health Portal at Roche.
Ahmed Ali, Chief Digital Health Portal at Roche.
Okay, that was quick. Maybe do another round, but okay. Last time it took us 10 minutes, so that's good. Last time we had a very fruitful discussion, and it was tackling a different approach. Maybe Heikel and I spoke along with Rafa also that it's very important. Why are we doing this? And I'd like to have Heikel, talk about why this is something important and how can each person help in the objective.
اوكي محتاج اقرب منه ولا انا صوتي كده خلاص؟
تمام.
صح؟ انا مش بعمل كده. اوكي يعني هو first يعني thank you طارق يعني for helping me ان انا الاودينس اللي يكون معانا النهارده على التيبل. هو this is the second time we meet in this round table. Some faces are familiar, we met the last time, and some faces are new. Thank you for those for attending. هو انت زي ما طارق كان بيتكلم، هو احنا يعني احنا المين اوبجيكتيف بتاعنا هنا ان احنا ازاي نقدر في الهيلث كير سيستم بتاعنا ازاي ان احنا نقدر نخليه مور اكسبتنس للانوفيشن، ازاي ان هو يقدر يكون مور انتو تو بي داتا دريفن هيلث كير سيستم، ان هو ياخد قراراته بيز على الداتا ويقدر يكابتشر الداتا ويقدر يعمل لها شير ويقدر يعمل لها كل حاجه في الداتا بحيث ان انت تساعد الهيلث كير سيستم. ويمكن البيز بتاعت حاجه زي كده ان النهارده انت اي هيلث كير سيستم موجود انت بيواجه مشاكل كتيره، اي هيلث كير سيستم موجود. واحنا في مصر عندنا جولدن اوبورتيونيتي انك انت النهارده في ريفورم بيحصل كبير قوي. في ريفورم في الهيلث كير سيكتور بيحصل كبير قوي. في هيئات جديده بتتخلق، في دايركشنز بقى لنا فتره يعني ما كناش نسمع عنها ان هي فيها فوكس، دلوقتي فيها فوكس جامد قوي. فده يعني لايك جولدن اوبورتيونيتي النهارده if we work together, especially and I tell برضه mainly لو work together with the government as public-private partnerships سواء شركات corporate سواء tech companies سواء startups سواء NGOs whatever. This is like يعني a golden opportunity ان احنا دلوقتي we can work together to be like an accelerator or catalyst للefforts اللي بتعمله الحكومه في الحته دي. ف this is why we are النهارده كده gathered. ويعني thank you for your attendance و I would like to hear your perspectives. وانا يعني القعده النهارده مين يعني عايز اسمع learn more about how you can يعني share this vision or how to contribute to this vision that we see for the health system. Thank you.
Thank you, Heikel, and maybe we can voluntarily start بدل ما احط spotlight على كل واحد we can take turns into discussing different things. But since I like putting people on the spotlight, I'm really heavy. وهذه يعني I'll leave it to you, and you have been working in the healthcare space for a long time, but now you have a new endeavor I'd like you to share with the esteemed panelists with us. Why did you decide to leave what you were doing and do this? Because you saw a pain point, a specific problem that space.
Thank you, Tariq, and thank you, Dr. Let me start from the end, and then we go to what we are doing and why we're doing it. I think to respond to what Taylor was saying is the partnership with the government and finding opportunities with the government is what will take us to the next step. A key factor in that, and I have been continuously talking to a lot of those authorities, is to unify the electronic prescription, not the electronic health record. Because the electronic health record might be too advanced for certain governments yet, but the electronic prescription is a very simple thing that can be done, but it needs to be verified and approved by government. And if we do a little lobbying on that, all the online consultation platforms, Zeta guys, we can all push in that direction to get a unified API to be approved by the government, and accordingly, we have electronic prescription. And more interestingly is to lobby as well, through probably corporate, is to go cross borders, because cross borders is what matters. We have a lot of questions in draft. I have my doctor in Lebanon prescribed for me this medication, but I cannot use this prescription in Canada. Okay, Canada is too difficult, but probably Egypt we can find a way. So this is an area where we really need to focus on. Now going back to our story, I've been in the brick and mortar distribution business of the healthcare side, and then actually before the COVID-19, we started the DRAP as a product, let's say, that we wanted to create an app to connect patients to their doctor to give online consultations. It was that basic, because it should work. Why it doesn't work? And then COVID started, and I decided to I could see where can this go, and it was as somebody said today, COVID is the perfect capex for that. So I moved completely to DRAP, and we took it from the perspective of the doctor. We looked at so many platforms that were trying to connect any patient with any, or the patient with any doctor. Now the question is, patients do not want to speak to any doctor, and this is the challenge here. And their doctor is not always available. He might be in surgery, he might be in with another patient. So it's not something that they can reach anytime, anywhere. So this challenge to break it was and still the major challenge that we are trying to unlock, because you want a patient to talk to that doctor, and that doctor is not always available, and the patient wants to speak to that doctor. So of course we thought of messaging as a base of the platform, so that both can respond at their ease at their time. And on the other side, we thought of having a fast response, like emergency response. So this is our story, and I really believe that the joint effort should be, if we were to do with the governments, is on the electronic prescription. Thank you.
You're the only one I'm going to put under the spotlight. Everyone else can chip in. Let's moving to Amr Tayyib. Wearing several hats. We started this discussion also at the end of the Disruptors App program. I think that this program specifically touched upon how can we innovate and how can we work with startups as corporates, investors, and startups together to come up with solutions that we were talking about, the pain points that we have identified. But moving on to looking at the big picture and your involvement as well as several hats that you give a quick intro. No one knows exactly what you do, but your input is very much appreciated.
So just very brief background. Originally, I'm a professor of neurosurgery, so I've been working in medicine and teaching students and seeing how students are starting their medical careers since 20 years. I've seen the governmental section law, and then the developmental section, and then started Smart Medical Services, which is basically started off as a an irregular TPA, moved into a digitalized TPA, and then entered the consumer market because it's a massive market and there's a need for people who are not insured. And since we leverage our software and technology, so we license our software to other players. This is very briefly what we do. And going back to our initial first discussion, the main catalyst again is, of course, is what is happening now. 10 years ago, our company was founded in 2010. This did not exist. All of this did not exist. There was no such thing as an ecosystem, as investors, as mentors. يا دوبك في 2014 started the idea of mentorship in 2013. But this is one part. This has to increase. It has to be in the right direction. And I think the coordination of it is quite important because of the direction. So we've seen a lot of people. The average age اللي موجود في الأوضة أعلى من average age اللي موجود في audience. So they're going to be thinking in a different way than we are going to be thinking. And I think this direction is extremely important. We now have success stories, and we have infrastructure, we have success stories, which are very important. We need to have some failure stories to explain the other side, because unfortunately, statistically speaking, 9 out of 10 are not going to make it. And I think this is important to the district, because if we keep on just selling the idea and all of this is going to work, then we need to explore the other side. The other part is the regulatory framework, which is changing in the country. This needs to really be explained to everyone who is starting a business, who has a current company, and it's the lobbying part is a bit difficult, but the explanation part isn't. Explaining more and more to people who are in healthcare currently, or going to start healthcare companies, or are in the business, then they need to understand very well what the regulatory changes are happening. This is going to affect everyone and everything. Then you go to the major dramatic change, which is the universal health insurance program. This has to be at every seat, with everyone, and it's no longer, before we used to say we need large corporates to large insurers, large providers, large pharmaceutical companies. These are the ones who are going to move everything forward. Yes, that's still true, but what is happening on the governmental side? It's bridging that gap. This is the key thing, and how do we bridge that gap? No one from the governmental sector, I think, is in our discussion today. We don't know what they're thinking. We can all read the laws. We can all talk to them individually. I think this is the next step. What I like about this year is that more and more the right people are here. So they need to be in the conversation. And their conversation is not easy. So we need to adapt to their conversation. They won't adapt to ours. But so we can adapt to theirs. Because it's a business opportunity. We all adapt. It's a business opportunity in the chat. The fine thing is that where the money is coming from. So investors are more and more, healthcare is becoming more attractive, more sexy for everyone. Fast track fintech was the banks. The banks enabled the fintech startups to work. The banks understood the value proposition. We have excellent examples of companies who are with us on the table, who have succeeded in every way. But I think the next generation of companies have to be funded by, partnered with the large, our banks. So our banks are the insurers, our banks are the pharma companies, our banks are the large providers. They need to start stepping up and understanding more, taking that risk. They're making excellent margins. They can afford to do that. If they manage to do that, I think this is what's going to really change the landscape. So in a couple of years, we'll be ready for that government conversation, regulatory framework, and the big corporates coming in.
Thanks, Sandra, and I would concur to what you're saying. Because we have, and we don't have the government here as Ministry of Health. We have 3 other representations in tech. But for our discussion, I know that you're already in talks, and there are a lot of things that are happening with the government, and maybe we can tackle the points that we need to address. There are a lot of positive things, but there are also things that we can say that there are areas of development. You mentioned investors, moving to investors, and I don't like to also point fingers, but باشا كبير يعني
I was gonna volunteer. تعطيك المسؤولية ومستنيك تبص لي عشان ارفع ايدي. I think the 2 points that were made are absolutely phenomenal. Right? So the first point that was made was start slightly smaller than your greatest ambition. So if our greatest ambition is to digitize healthcare records, starting with prescriptions is a really good way to start working and building. The other point was the point Amr made, which was about learnings from banks. There's a ton of learnings for us from financial services. Even way before fintech was a thing, right? When the banks started building POS networks, they realized that they will be competing on POS networks. So the banks created something called Moneris. Moneris was a singular POS network co-owned by all the banks, right? So there's a lot of learnings for us here, even from the EU Commission just a few weeks ago, forcing the Samsungs and the Apples of the world to use the same charger port, right? It's so hard for a country to allow all of its patient data to be owned by a singular private sector player. It's a huge risk. Fine, I accept and acknowledge that. What are we going to do about it? Let's build a company, even if it's publicly owned or publicly and privately owned, that would own this data or would own it in partnership with the hospitals that provide it. Right? So this data is necessary for teams like Proteina to be able to build some of the products that they're building. It's necessary for Hedi to build some of the products that he's trying to build. But we can't have Hedi or Mahmoud and Abdulaziz own this data, right? But we can certainly create a company owned by the hospitals and the public sector that owns this data, that's run by people who can build this type of company, right? So there are learnings from what the banks did back in the day. There are learnings from yesterday from the EU Commission. If we can push in a uniform direction towards a clear, definitive goal, we can do that. So we have to give a very clear, finalized solution with a very clear structure and push towards it, not push towards abstract legislative change. We say, this is exactly what we want. This is exactly what the company is going to look like. This is exactly what the cap table is going to look like. Every major hospital is going to own shares. The ministry is going to own shares. Everyone who needs to own shares will own shares. Right? So if we go with a finalized, well-packaged, clear solution and repeat the same message again and again and again and again, we will get it. التكرار بيعلم الدنيا. هنفضل بنقول نفس الجملة تاني ورابع وخامس. عايزين شركة مملوكة لكل المستشفيات ووزارة الصحة تملك الداتا بتاعت كل الشعب المصري. هنفضل نقول ده كل سنة لمدة 10 سنين. في الآخر هنفضل. بس لازم نروح المسج fully packaged, fully ready, fully clear, led by someone employed and already leading this company that is established. So نبتدي من الجراس روتس، نبتدي بالمستشفيات، نأسس الشركة، نجيب CEO, and that is the message, a unified, clear product that is already available and ready to be accepted into the fold.
I want to couple and kind of piggyback on what you're saying here. I think you've made a really solid case that all of us together, our voices are much stronger, and we can certainly advocate and achieve much more quickly. سواء 10 سنين ولا 30 سنة ولا إن شاء الله يبقى أقرب من كده بكتير. But the point here is that I think I've heard this once, now twice, this is the third time, that we're all in alignment, that we cannot go alone. Our voices are much weaker. We cannot achieve what we want in isolation. And what I really like to come in is that you've added a very clear solution, right? What I invite us all to consider is what I think Amr mentioned here. There's nobody from the government at the table. In order for us to advance that solution, we have to co-create it at the design phase with the government. Because if they aren't bought into this, if they don't believe in that this is a priority, if we're not listening first. We've got 2 ears and 1 mouth. For a reason, right? We've got 2 ears, we listen first, and then we come to them with a solution in co-creation at the design phase together with them. Then we're going to have a solid owner inside the government. Then we're going to have somebody that's going to drive and push this agenda forward. Not agenda, I don't like using the word agenda in Egypt. This direction or this opportunity or this proposal, many other synonyms of using that. Then you can definitely have somebody that will carry this forward. من غير ما احنا we're pushing لازم يبقى هم معانا في اول الخط، مش ان احنا فكرنا اصلا لوحدنا، يعني القعده دي اصلا لوحدها ممكن شبه حرام. Let's bring somebody at the table and make sure that they're a part of the conversation so that they feel ownership. Without government ownership, we cannot advance what we want. They have to buy into it as a priority in design phase.
شكرا جدا طارق، شكرا جدا. خلينا بس يعني هو احنا النهارده بنتكلم على الفكره بتاعت ان احنا النهارده عايزين نروح للهيلث كير انوفيشن. هو السؤال الاول يعني يا ترى هل احنا حاطين ايدينا على الاسباب الكود اللي احنا واصلين لها دلوقتي؟ لان احنا اوريدي تقريبا ما فيش اي حد من الانفستورز او من الجفرمنت بدا يدرك الهيلث كير الا بعد كوفيد. قبل كده احنا كنا بعيد خالص تماما عن ان احنا نفكر كلنا في الهيلث كير اندستري. حتى برضه في الايفنتس زي تكنا او غيره احنا كنا مش بنشوف الهيلث كير اندستري كان ليها يعني هايلايتنج عليها الا بعد كوفيد 19. طيب السؤال، هل الاندستري دي الهيلث كير اندستري كان لها نيد قبل كوفيد 19 وجات كوفيد 19 اكسلريتنج النيدز دي، وبالتالي احنا لو حطينا ايدينا على النيدز الموجوده دي نقدر نعمل ده؟ According to Admission Consulting Group في 2018 عملت 3 حاجات، قالت 6 things that doctors need, 6 things that patient need، والاندستري نفسها هي محتاجه ايه 6 حاجات دول. الاستادي دي كانت رائعه جدا، ولما جت كوفيد 19 عملت هايلايتنج على ال6 حاجات بتاع كل حاجه فيها. لو جينا بصينا مثلا على الاندستري، اول حاجه الاندستري محتاجاها هي اول حاجه نيو كوميونيكيشن تول. اول حاجه نيو كوميونيكيشن تول. ازاي احنا النهارده هنروح نتكلم على بيشنت داتا، ازاي هنتكلم على بيشنت دريفن داتا واحنا اصلا الاندستري كلها اصبحت كاستمر دريفن اندستري. احنا كلنا سيبنا البيشنت، وجينا كلنا للدكاتره، وجينا كلنا للمستشفيات وسيبنا البيشنت اصلا. طيب لما تيجي تبص على ثاني حاجه هي الاندستري محتاجاها هي انفورمد بيشنت، ان احنا في الاصل وي شود انفورمد البيشنت بتاعنا عن اللي احنا عايزين نعمله. احنا اوريدي النهارده تقريبا كل الانوفيتيف ايديا اللي موجوده في الماركت كلها كل واحد واخد سيكتور. احنا عندنا في 3 تايبس اوف انوفيشنز موجودين في الماركت. اما في شركات ستارت اب بتنوفيت على البيشنت جيرني زي فيزيتا، هي بتشتغل على البيشنت جيرني ستارتنج من اول لما يكون عايز يكشف الى ان هو يوصل له البرودكت لغايه بيته. النقطه الثانيه اللي الناس شغاله عليها هي الدكتورز كونكشنز بعضهم مع بعض، وده مش حاصل اصلا واحنا بنسميه اللي هم الهيلث كير بروفيشنال، مثلا نسميهم وليكن الجروبس او نسميهم الكوميتيز بتاعتهم، ده مش حاصل. مفيش اي شركه دخلت حاولت ان هي تربط الاطباء ببعضهم. احنا عندنا تقريبا اكثر من 80,000 عياده في مصر، محدش حاول يكونكت الدكاتره ببعضهم. حتى لما ده حصل اوتسايد ايجيبت كان من خلال روش ومن خلال فايزر، من خلال بعض الويب سايتس اللي حصلت بره، بس ما نجحتش. الحاجه الثالثه كانت هي بيشنت دريفن ستارت ابس او البيشنت داتا، وده ما فيش اي ستارت اب لغايه دلوقتي في مصر قادره ان هي تدخل للحته دي، لانها حته كريتيكال زي ما تامر قال بالظبط، وهي احنا بنحتاج فيها بشكل كبير جدا الجفرمنت زي ما حضرتك قلت بالظبط، ومحتاجين بشكل كبير جدا يكون في سبورت من كل الستاك هولدرز اللي شغالين في الاندستري. وبالتالي فانا لو جينا بصينا هنلاقي اول حاجه كانت بتتكلم عليها هي رقم 1 كانت النيو كوميونيكيشن تول اللي مع البيشنت ومع الدكتورز، رقم 2 كانت انفورمد البيشنت، رقم 3 كانت الاكشن بالديتا. تقريبا الهيلث كير اندستري احنا اكبر اندستري عندنا كم داتا محدش فينا بيعمل بيها حاجه. تقريبا احنا اكتر اندستري فيها الفلو اوف داتا مرعب، ومحدش فينا قادر ياخد الداتا دي يصنع منها حاجه تفيد البيشنت نفسه قبل ما تفيد الديسيجن ميكرز اللي في الاندستري. رقم 4 ذا فيوتشر اوف هيلث كير اندستري، وده كان سؤال مهم جدا سالوه كل الناس اللي في الاندستري، هل تتخيل ان الفيوتشر اوف اندستري هو في حاجه من الاثنين، ديجيتاليزيشن ولا البيشنت سنتريك ابروتش، ان احنا نطلع تاني من الكاستمر سنتريك ابروتش. كانت المفاجاه ان كل الناس اللي دخلت في الاستادي قالوا ان هي بيشنت سنتريك ابروتش ذن ديجيتاليزيشن، يعني الديجيتاليزيشن بيجي رانكينج نمبر 2 بعد البيشنت سنتريك ابروتش. الحاجه الرابعه والاخيره هي الحاجه السادسه والاخيره اللي كانت استاذ اتكلمت عنها، قالت ان احنا النهارده لو عايزين الاكشوال داتا فوي شود ان احنا كلنا نشتغل على الاي ام سي، الانتجريتد ماركتنج كوميونيكيشن، او بلاش نقول ماركتنج، لو قلنا الانتجريتد كوميونيكيشنز ما بين كل الستيك هولدرز اللي شغالين فيها. الفاليو تشين بتاعت الدكتور نفسه ان احنا انتر كونكت مع الفاليو تشين بتاعت شركات الدواء، مع الفاليو تشين بتاعت الهيلثي انشورنس كومباني، مع الفاليو تشين بتاعت البيشنت نفسه. لو قدرنا نعمل كونكشنز دي، الفاليو تشينز دي كلها رابطه في بعضها، وي كان كرييت وات وي يعني نقدر نوصل اللي احنا عايزين ان احنا نعمله. شكرا جدا.
مش هشاور على حد، بس I think I think we're talking about several things وكلها برضه بتصب في اتجاه واحد ان احنا we need to see what everyone can bring on the table so that we can eventually put something together and then في the initial discussions زي ما صار نبتدي ان احنا involve the right people on the table. بس moving to عمر برضه the last time we didn't talk, having a development agency on board with us and understanding how can you contribute to what we want to achieve.
طيب هو اللي بشتغل فيه زميلي على امباكت انفستمنت. opportunities موجوده مش بس لسيكتور معين، بس opportunities موجوده ل all different sectors على how to be related more to impact. ممكن في business كتير جدا بتشتغل بس ما يبقاش فيه فوكس على كلمه impact، حتى لو ده بنركز برضه على الهيلث كير، كم الحاجات اللي بتطلع من البيزنسز اللي بتفيد الناس، بتفيد البيشنتس، بتفيد الدكاتره، حتى لو دخلنا في التك، بس ما بيبقاش فيه emphasis على كلمه impact وازاي ممكن تستخدم impact بدل contribute ل SDGs او في الانفستمنت بلان بتاعتك. في سيشن كانت حلوه جدا، كانت الصبح على impact investing والدسكشنز فيها كانت قويه جدا. من الحاجات اللي احنا بنعملها ان في الامباكت مفيش حد قادر ان هو يقيس هو وصل لفين من ناحيه الامباكت او الانديكيتورز. في ماتريكس ثانيه تبقى موجوده بتساعد على ان حد يقدر يقيس الامباكت بتاعه او امباكت مانجمنت، الامباكت مانجمنت، بس لسه مش متوفره في مصر بشكل كاستم، يعني بشكل ستاندردايز او بشكل سوليد. يعني اتس فيري فري فلو. بنحاول نعمله دلوقتي ان احنا بنطلع بتول تبقى very solid that can help all industries utilize it، ان هم يقدروا يحطوا indicators that are very set, very structured، ليها ماتريكس تقدر ان هي تتقاس، يقدروا بعد كده ان هم يشوفوا ازاي they're contributing to SDGs or to the community or to the sectors ان هم they're targeting. can be used بعد كده to link with different investors ان هم يقدروا fund managers دلوقتي كتير جدا venture capitals و private equities ابتدوا يبصوا اكتر على فكره impact وازاي على ان احنا محتاجين نساعد build a proper or a better community with impact. ففي initiatives ابتدت ان هي تطلع من UNDP supporting the private sector specifically كمان على التول دي وعلى how impact can start to take a move forward. يعني. فانا سامع من الناس هنا افكار حلوه جدا. ممكن اللي انا بقوله ده ممكن يبقى بعيد عن المشكله الاساسيه اللي انتوا بتتكلموا فيها على regulatory framework او على discussions مع الحكومه، بس في الاخر حتى لما الافكار دي تبتدي ان هي تترتب وتشتغل، وين انتوا شايفين ايه بالظبط الليفل اوف كونتريبيوشن والليفل اوف امباكت اللي بتعملوه، هتبقى مهمه بعد كده to take into consideration.
And Hekel, we discussed previously a few different angles on moving forward, bringing different stakeholders on board. Your views on how to move forward and what can we bring on the table, definitely as Roche, but with everyone who has been in the discussion.
هو يمكن الستارتنج بوينت هي كانت زي ما كنت بتتكلم عن الستارتنج بوينت النهارده، احنا النهارده عايزين نشتغل، هي فعلا بتاعت وين، يعني احنا عايزين في الاخر الهيلث كير سيستم بتاعنا وين، واحنا از بزنسز نوت وين ستارت. الستارتنج بوينت ان انت لازم تكون انت معاك الجفرمنت ابلكيشن تبتدي برين ستور وديزاين وات ذا سوليوشن. انا مش عارف، انا سامع هنا حاجه سوليوشنز تطلع زي الديسكربشن زي الحته المون بيس اللي هو يبقى فيه بيتكلم عليه. انا مش عارف وير وي ستاند فيها ووصلت لمين ووقفت فين، بس انا فاكر first time to hear about it, so I'm interested to know more about it. يعني بس الستارتنج بوينت النهارده ان احنا نقعد whoever we have a solution with interested to offer solution to this part out and design it together to find a common solution that has a win-win for all the stakeholders. And we as Roche احنا دورنا هنا احنا داخلين الحته دي mainly to ensure السستينابيلتي بتاعت الهيلث كير سيستم. احنا يعني روش من ضمن الشركات اللي بتبقى بتعمل long term bets. We have the luxury ان انت تقدر invest without return on investment at some time. So this is the luxury that we have that we are now trying to do because this is يعني if we do this is a good business on the long term for us. This is what we are trying to do at the moment.
Just a quick comment. Today, in one of the sessions that I was attending, I think there was the director of the universal insurance entity, and he mentioned something about the new company on the e-health, I think. So it might be something that you are mentioning, and I don't know if somebody could, has more information about this, the e-health company, and how we can talk to them all together.
So if you allow me, one problem is every one of us has some information about what is happening. Collectively, we probably know a lot, so we can plan a lot. I agree completely about the ownership. They are very, very willing for exploring the ideas. They piloted with other larger corporations, whether insurance or hospitals. This has been in the making for quite some time. This is going to be what handles all the healthcare part. And a lot of what we're saying is going to be dictated. There's going to be a framework which we're going to fit into. And that's how I completely agree they have to be in these discussions. The good part is that they really want to be in these discussions. They feel left out, missing out. And we have this opportunity. And again, in that panel, they will attend this. This is something they are attending summit. This is not something which happened. But some of the ideas are in progress. E-health is project finance. It is not like funding. It is not like willpower. And we don't know is how we're going to collaborate. That bridging of that gap. We do not want to know after things have happened. And we don't want to discuss a lot of things. And then discover ده احنا ما كانش المفروض نكتب باللانجوج دي المفروض نكتب كده. ده الستراكشر بتاع الداتابيس كده بدل الستراكشر. الديتيلز هي اللي بتسحبنا وهي اللي بتبوظ الموضوع. If you don't build them correctly from the beginning, you really suffer in that transformation. So this is happening, and I think if actionable ideas is having things which are more specific and talking to them, because a lot of it is vague, and I understand why it's vague, because it's a humongous project, a lot of challenges, but we need to understand more, and maybe we talking to the maybe big, we don't like to really use the word lobby, but lobby in its proper sense is a correct word.
Usually we have bits and pieces of this what's happening. Usually we approach the stakeholders لوحدنا. فبرضه having like something like مش عارف اسميها ايه مش هسميها نقابه ولا هسميها حاجه coalition حاجه كده small term بتتجمعوا for certain objective and then we dismantle. فhaving this type of team او task force بيشتغل على حاجه زي كده. We have one sound, we have like position paper that what we are offering, what we can help. This maybe as well can help in conversation. بدل ما هو برضه شركه لوحدها مهما كانت شركه كبيره على فكره مالهاش علاقه لا ستارت اب ولا شركه كبيره هو الموضوع واحد كل عارف having this type of team up for something like this I believe this will be catalyst for something.
زي انتوا اسامي انا اسمي شلبي I was the chief medical officer. I'm in charge of digital health at the moment for AXA One Health. And it sounds to me like we're kind of trying to do the right thing. And AXA and One Health is a nice use case for what's been described around the table here. It's a data-driven, customer-centric healthcare provider. And people are both steps back and explain what AXA is about. So AXA sure a lot of you have heard, is a very big insurance company, one of the biggest healthcare insurance outside of North America, and one of the two highest interests in AXA, besides obviously being the insurance and the money or an asset management company, is climate change and healthcare. And that's because AXA is a very conscientious company and it really wants to protect human progress and really act with what matters. مثلا AXA has divested from fossil fuel investments عشان they want to protect the environment. They have completely removed all kinds of investments in the smoking industry because they are protecting health. And to take that a step further, they created One Health to be a healthcare delivery arm to actually own the process, because again, protection is better than cure for them. So from a financial perspective, of course, it makes sense that they don't want to be paying out for healthcare, but at the same time, there is this, a humanitarian side that they want people to become healthy. And two of the biggest drivers for AXA are simplicity and innovation. And that's what is also being applied within One Health, and I can let Hussein talk a little bit about how we're doing that in One Health. But we want to simplify the customer journey. We want to find innovative, not necessarily high-tech solutions, but simple solutions to improve the customer journey and to create all of the things, to create the value that you've been describing around the table. We had started also discussions with the Minister of Health and the government, and it's incredibly important to be aligned. I don't think any of us is really reinventing the wheel. We're just all trying to test and create something that eventually works. Thank you for that.
Yes. اسمي حسن مطر, Chief Medical Officer of One Health again. وأنا academically I'm a doctor as well. خلينا نقول إن there are a lot of interesting topics that we are discussing here. Three letters that I want to say: private-public partnership does not exist in Egypt. الحقيقة مش موجود, مفيش حد بيفكر فيها. In healthcare specifically. I will give some examples. خلينا حتى كمان قبل ال public-private partnership نتكلم حتى على ال public-public partnership. Universal health insurance, they have the e-health that they are developing. At the same exact time, القصر العيني بيشتري electronic medical record لوحده. At the same exact time, عين شمس بتشتري electronic medical record لوحدها. كل واحد شغال في direction. المفروض إن ده توجه الدولة to digitalize the healthcare. Still, كل entity, governmental entity, شغالة لوحدها. وفي experience I think طبعا rush guys و other guys know it. هيئة الشراء الموحد اللي عملوها, so they can do something, right? But we don't understand why إن دي كل واحد شغال في direction لوحده. كل ده احنا بنتكلم على government بس, ما بنتكلمش على public-private partnership. لو اتكلمنا بقى على private partnership, it's the same issue as well. كل player بيشتغل في direction لوحده, وكل player sort of خايف ان هو ينتجريت مع حد او ان هو يدخل في partnership مع حد او حاجه زي كده. Even لو مفيش let's say conflict of interest still في paranoid كده behavior موجود عند اغلب البلايرز في البرايفت قبل ما يكون حتى موجود في البابليك الحالي. واحنا يمكن زي ما علي قال, يعني the way we deliver healthcare is a little bit different يعني than the players هنا في private sector. we approached a lot of the private sectors to have partnerships معاهم to complement يعني our offering. We don't have hospitals, we don't have tertiary care, this kind of stuff. We have primary care, we have secondary care, we have digital health, telemedicine, but we wanted to complement our offering with tertiary care as well. So we have our own electronic medical records, and we wanted to have a partnership with private sector. No one was willing to do any sort of integration and share any sort of data. So that's something also needs to be aware ان المشكله مش موجوده بس في الحكومه, لا موجوده في البرايفت كمان. واحنا بالتبعيه مش عارفين نشتغل لا مع البرايفت ولا مع البابليك. give a quick example على public as well. We offered to one of the universities, مش هقول اسمها, but we offered them the electronic medical record solution for free actually. But they were not willing to take it, so actually they are buying now. مش عارف ليه, بس يعني I know mainly because of the data. They are afraid that we will have an access to the data. قلنا لهم هيبقى servers عندكم كل حاجة عندكم, and the only one who can access are your teams يعني. But still في برضه جزء كده paranoid برضه موجود, إنه مفيش حد عايز يبقى في real collaboration between the different players. But this is something interesting. يعني I like a lot that we are tackling this point, because this is one of the big bottlenecks موجودة في healthcare industry الحقيقة في مصر. And I like a lot the idea that we should have some sort of chamber maybe or something like that, where we can put everything on the table and agree among the private sector. قبل ما نتكلم ونقول الحكومة مفيش ما بتتعاونش مع البرايفت ما بتتعاونش مع بعض, الحكومة كمان ما بتتعاونش مع بعضها different entities. But that's something I think that we should all consider, that we have a chamber that you propose here, and we have one voice that we can talk to, and we can really do something on that regard. Thank you.
Thank you. I think we had one interaction.
كله بيتكلم هنا عن الفرونت اند انوفيشن، محدش بيتكلم عن باك اند انوفيشن. كله بيتكلم عن ازاي يتعامل مع الكاستمر، بس ازاي بقى اعمل الدواء نفسه مش حد يتكلم عليه. هنعمل بالظبط احنا بنحول الهيدي كاليكس واللونج تيرم بتاع developing new drug فاكسين مثلا للاي بس. وشفنا اصلا مع كوفيد مش حد زي روش هو اللي عامل فاكسين، بس حد زي موديرنا ويندك في المانيا، كانت بول فايزر هو اللي سواه. فده اللي بنعمله في مصر يعني. بس شركه في مصر وامريكا بس، ومفيش حد هنا بيتكلم في حاجه زي كده. وحتى في صعوبه شويه ان نبدا داتا عشان نعرف نعمل فاكسين، ولا نخش مثلا نعمل تيستنج مثلا نعمل تيستنج حتى كده. بس فاضطرينا نخش مع حد زي فاركو مثلا مش عارفين في مصر. بدأنا في الأول بره مصر، ناس في اسكتلندا بلجيكا، بعد كده خدنا منهم الخيط إن إحنا كويسين، بعد كده جينا في مصر هنا حد زي فاركو وإيفا شوية دول بنتكلم معاهم شوية. بس وشايف المفروض دي حتة مهمة عشان دي الفاليو الحقيقي، الميشن الحقيقي في السبلاي تشين بتاعت الكتير. بس دايما نستنى حد يعمل حاجة بره وناخد منه، فشايفين ممكن يبقى في لوكال حد ستارت اب هنا كومباني بتعمل جود برودكت. يعني الكوفيد فاكسين حاجه انترناشونال، بنتكلم فيها ادويه او فيها امراض محليه شويه في مصر وفي المنطقه هنا وفي افريقيا حتى مش حد شغال عليها، فلازم حد من المنطقه هو اللي يشتغل على حاجه زي كده.
ممكن اضيف حاجه هنا كمان. I think it's important to notice ان احنا we all came to the table with a different challenge. But if we were to all come together, I don't think we can go straight to the actions. We can't go straight to solutions. We all have a solution in mind, but like what Hassan was saying, it's a brilliant point. We don't work together enough to identify our own collective challenges so that we can identify the priorities in the government and match challenge, priority, solution. This is our win-win وبقى win كمان. يعني additional win في الوين كلهم مع بعض عشان you need to make sure that we all need to make sure that we share one common voice across what are the challenges, how do they match up to priorities that the government is trying to adopt or trying to advance, well, accordingly the outcome would be the solutions that احنا ممكن co-create and design معاهم in partnership.
يعني هو one last comment. Sooner or later احنا مش هيبقى عندنا option, won't be an option to make such a gathering or chamber as Dr. Hassan mentioned. فيعني we have more players. احنا عندنا الفارماكوس وعندنا الانفستورز وعندنا التك وعندنا الانشورنس فيرمز. فيعني let's take it from there وهيك قال لنا ازاي take it forward. يعني احنا we all excited about it. بس again زي ما دكتور حسام mentioned احنا بنعمل كل ده سيرفيس. فاحنا كفيزيتا بنيجي عندكم في روش ونقول لكم هنعمل معاكم فيجن سبورت بروجرامز، بس مثلا مش متفقين مع اكسا هنصور واكسا بتفصل يعني. فاحنا we need to make something solid very soon. يعني it won't be an option.
I think one of the main reasons actually coming together on this roundtable is to put all our backgrounds together or our challenges together عشان نقدر نطلع باكشن بوينتس and then eventually نقدر ان احنا يعني ناخد الاكشن ده.
في بس ممكن احط نقطه بسيطه خالص في ريبورت نزل كان السنه دي في 2021 بتاع البيزنس موديل بتاع الفارما اندستري اللي بيتكلم على الريشيبنج للبيزنس موديل عموما. يعني هم تقريبا بره عملوا نفس اللي بيعملوا ده تقريبا. لو احنا يعني تقريبا حطينا الرولز دي او الحاجات اللي هم مشوا بيها فتقريبا احنا ممكن نوصل برضه. زي بالظبط مثال زي ما حضرتك قلت على موضوع استرازينيكا مثلا الفاكسين ما بين فايزر بايوتك. هم بداوا بره يعملوا نفس الفكره ده، فكره الانتجريشن. انا النهارده مش زي ما حضرتك قلت برضه ان انا بعمل سيرفيس ميبي اللي ممكن يكون حد تاني على الترابيزه بيعملها، فنقدر احنا انتجريت ونعمل ده وين كلنا نفوز في الاول وفي الاخر. فانا من وجهه نظري ممكن هيك هو يحط فريم اوت فريم ورك الكلام ده، ممكن نحط الموديل ده قدامنا وهو ممكن يساعدنا بشكل كبير جدا ان احنا كولابوريت ما بيننا وبين بعض في الاول وفي الاخر عشان نوصل. الهدف بتاعنا ان احنا نوصل ليونيفايد نقول مثلا انتيتي او كيان وات ايفر كان شكله ايه، وفي نفس الوقت ان احنا نشوف التشالنجز الموجوده ايه، وفي نفس الوقت نشوف احنا النهارده نقدر نقدم للستارت ابس. بقت مصر فيها ستارت ابس كتيره جدا جدا جدا، ناس مشكلتها ان هي محتاجه بس فاينانشال سبورت، ناس مشكلتها ان هي محتاجه انتيتي زي روش ترعاها او اكسا ان هي ترعاها، وهو هيقدر يعمل حاجات كويسه جدا. وازاي احنا نقدر نربط ما بين كل النقط الفاضيه دي. لو قدرنا نعمل كده، احنا لو عملنا ده النهارده يبقى يعني رائع جدا.
احب اضيف حاجه بس صغيره هنا. يعني متخيل اهميه السيستم اللي احنا بنتكلم فيه دلوقتي، مش بس الايميديت gain of organizing the sector making it more customer centric, more قصدي patient centric يعني. لكن going forward الداتا دي will really drive innovation. فمتخيل واحنا بنحدد شويه the first market that will enter as Bikini يعني with our Bikini engineering platform and like a drug development platform يعني we struggle to find disease data about Egyptian patients and so on. The data that will be collected through this platform will be key to enabling the next wave, which is what we are talking about, not just like organizing the market, but the next wave of developing our own products and our own drugs that will conquer the world يعني في الجزء ده. وعندي هنا شاهدين على الجزء ده. الشاهد الاولاني احنا الجامعات حاليا specifically الجامعات الاهليه they have a model that's currently driving more and more innovations. فبالتالي مثلا على جامعات الحكومه بتفتحها دلوقتي very separate from الموديل اللي بيحصل في الجامعات الحكوميه دلوقتي research based learning integration of AI and tech with every sector. وده is building an ecosystem around every specific sector which is coming مثلا for healthcare for example. So drug design and drug development. So Moderna vaccine just good designed in 2 days, which is insane. We have a lot of brilliant engineers that could do the same here in Egypt, but with the same with a good amount of data about what are the challenges and with a good amount of partnerships. فأعتقد يعني the good will not be only the low-hanging fruit that we're talking about, but also going forward the next wave, which is driving more innovation into building like a more innovative ecosystem.
My support here اللي انت بتقوله بالظبط ان احنا we have a challenge in سنتين كان basically احنا كنا بندور على solutions in non-communicable diseases using big data. احنا كنا actually بندور على back line مش front line solutions، بس احنا we have an invitation في موضوع data وكان السربرايز بتاعتنا احنا ما رحناش للجفرمنت. احنا قلنا طبعا الجفرمنت هياخد وقت كتير عشان يكون ديتا، احنا رحنا نقول برايفت سيكتور. وas a human agency يعني احنا purely يعني developmental agencies مش بنشتغل for profit. احنا اترفض كذا مره ودي كانت شوك بالنسبه لنا. فاعتقد احنا we ended up في الاخر ان احنا patient based solutions which برضه كانوا كويسين بس ما كانوش الطموح اللي احنا كنا عايزين نوصل له. On the second point برضه انا حاسس ان there's a gap في الانوفيشن. I know that مثلا لما بتقابل ناس في فارما whether Novartis او روش او كده بقى ليهم delivery advance. لما باجي اتكلم مع ناس في ايكو سيستم في جاب كبير قوي. I think a part of the solution ان هو يحاول reduce الجاب من النولج اللي موجوده مثلا في التيبل دي لازم تضاف عليهم. فان احنا برضه نحاول نكسبوز them للانترناشونال اكسبيرينس اللي هو فعلا هيخليهم ستاندرد اعلى. ان احنا نعرف نجيب سوليوشنز اعلى. I think those are one of the things that we should focus on.
If I may add a small thing here, the trade-off is إنه بعد كده لو يعني if you have startups and the startups they don't find Egyptian data or African data, they have two paths. The first one is to collect data themselves, so they access patients and collect genomic data or something like this. Or they will work on existing data from European nationalities nationalities هتفضل نفس المشكله موجوده. كان في ريبورت باي ويلكم تراست بيتكلم عن انه there's a specific infectious disease. الديزيز ده له treatment biologic drug. 95% من ال death cases are happening in low and middle income countries. 95% من السيلز are happening in the US and Africa. In the US and Europe. ف there is a huge disproportion في ال development process and we have to enter this part as part of the equation.
Okay, I think to sum it up and wrap up, and having a strategy on how we want to take things forward for our discussion and the previous ones requires efforts with everyone. It requires to take these action points and put it together before we can develop it further and involve the right people. So I think this is part of a discussion that we need to also talk about with the rest of the team, and then revert back and have more close to the meeting. And we had a big gap عشان كده بعد رمضان لغاية دلوقتي. So I think before end of year we need to have maybe probably next month another small meeting. حتى لو كان virtual, I know it's hard to bring everyone on the same table at the same time, بس يعني قلنا ما ينفعش يبقى في تاكلينج ويبقى نجمع الناس اللي موجودة already. So maybe probably within 2 to 4 weeks we can try to share something and share something before and then come together in a virtual meeting and decide accordingly the actions.